There's a couple of things that we need to keep in mind as far as extractions go when we're doing extractions, and simple extractions or surgical extractions, these concepts will apply. And one of the things that we need to keep in mind, especially when we're working with cats, is that tissue is extremely thin. It's extremely friable, and so we're doing literally microsurgery when we're doing this. So one thing that I would recommend that everybody do in this room, if you don't already have this, is to get some surgical magnification, plus or minus a portable light source that fits on that surgical magnification that allows you to see these little bitty teeth roots in cats, because they're very difficult. Even with magnification sometimes, if we fracture one, especially the distal root on that first molar, to retrieve them. So if you've got surgical magnification, you've got to step up above the complications before they start. Look at this image and you'll see that my finger is right on the tip of that instrument. And the reason for that is it allows me to leverage my finger against the tissue as I'm trying to work that luxator into the space between the bone and the tooth root. So I've got a lot of control. And if I go there's no way that I can go too far with my finger adjacent to the tissue while I'm working that with the butt of my hand against the butt of that luxator. So it makes it very safe, not only for you, but also for the patient, so that you don't jam that luxator up into an orbit, which has happened on numerous occasions in dogs and cats. So it gives you a lot of control over the instrument as long as your finger is right up next to the end of it. The other thing that you need to keep in mind when we're extracting, especially cat teeth, is they're very prone to fracture when you remove them. They're very little roots as far as their diameter goes, and they can be pretty long in some cases, especially the incisors, and that distal root on that first molar. So what we want to make sure that we do is very gently luxate, and then once we get to the point where we've got some mobility and we put the extraction forceps on that crown, it's more of a pull with a slight torque, just like it would be if you were removing a cork from a wine bottle. You don't want to jam that cork down in and keep turning it while you're trying to pull that cork out, or it's going to do just what this one has done in this picture. It's just going to crumble, just like the root's going to fracture. So it's more of a pull, very, very controlled pull with not a lot of force, with a little bit of rotational back and forth. And if you do that, you're still going to fracture some roots, but it's going to give you the advantage of fracturing a lot less than you would if you got in there and were really aggressive with it. When you're using a luxator with cats, what you're going to want to do is make sure that you put very little pressure on those tooth roots when you're trying to luxate them. In dogs, you can grab with all of your fingers in some cases and put a lot of pressure on those bigger roots like the canine and the first mandibular premolar, but in cats you can't do that. It's more of a 2 fingers pressure is about all you want to put on those when you're trying to luxate them. When you're trying to get purchase between the bone and the tooth root, it's okay to use a rocking motion back and forth with the luxator to try to force it in with controlled apical pressure.